first foster family care program in the United States was the placing out system established by Charles Loring Brace in 1853. Children were rounded up from the city streets and shipped to rural communities where committees of citizens arranged for them to be taken in by families. Today, there are approximately 500,000 children in foster care at any given time in the United States. Foster children make up a population that easily becomes invisible within society and is particularly plagued by mental illness. Yet, due to unstable living conditions, scattered mental health records, inefficient care coordination, and inappropriate administration of psychotropic medication, foster children do not receive satisfactory mental health services. Increased emphasis on the mental health care of foster children is necessary to ensure them better mental health and increase visibility in society. Recent studies suggest that up to 80% of children in foster care have significant mental health issues, whereas approximately 18 to 22% of children in the general population have significant mental health issues. Foster children also describe more attention problems, social problems, delinquent and aggressive behavior, and symptoms of anxiousness or depression compared to a community comparison group. However, 3 out of 4 children who enter the foster care system who have clear clinical impairment do not receive mental health care within the next 12 months. In 1947, Ralph Ellison wrote Invisible Man about the invisibility of African Americans, in which he stated, "I was, and yet I was invisible. That was the fundamental contradiction. I was, and yet I was unseen." We can't let foster children in this nation feel the same. The first obstacle to quality mental health care for foster children is unstable living conditions. As of 2001, the average length of time that a child stayed in foster care was 21 months, and as the time a child stays in foster care increases, usually so does their number of placements. In one study, 41% of children had more than 3 foster care placements, and 5% had episodic foster care during just 1 year of observation. It turns out, both multiple placements and episodic foster care increase the predicted probability of high mental health service use, and placement instability is associated with increased mental health costs during the first year in foster care. Foster children are constantly dealing with impermanent living conditions, which not only makes them more invisible, but contributes to their high levels of mental illness. Despite these high levels, mental health records of foster children are generally scattered and disorganized. To address this issue, some states have implemented an abbreviated paper or computerized medical record referred to as the foster child's health passport. This includes the child's chronic health problems, allergies, medications, psychological history, and trauma history, among others. The American Academy of Pediatrics also recommends that foster children have an initial health assessment within 72 hours of placement and a comprehensive health evaluation within 30 days of placement. Standardized screening processes and comprehensive mental health records are necessary for foster children to receive quality mental health care wherever they are and will prevent mentally ill foster children from becoming invisible within a complex, volatile system. Ineffective care coordination is another barrier to quality mental health care services for foster children. Care coordination is particularly difficult for children in foster care because of the blurred lines of authority among parents, child welfare professionals, and the courts. In addition, there's a shortage of mental health care professionals with appropriate training in trauma-focused therapies who understand the complexities of the foster care system. State and local child welfare systems should ideally appoint a medical director responsible for the oversight and coordination of healthcare systems for children in foster care. Streamlined, centralized processes to quickly provide treatment to mentally ill foster children are essential to ensuring them the highest level of care. The appropriate administration of psychotropic medication to mentally ill foster children is also necessary to improve their quality of mental health care. According to a report by the Government Accountability Office, children in foster care prescribed antipsychotic drugs at double to quadruple the rate of that not in foster care. Further, a study conducted in Texas found that children in foster care enrolled in Medicaid were 3 times as likely to receive psychotropic medication than other children enrolled in Medicaid. One NPR segment recounted the story of Delangelo Cortijo, who, by age 14, had been to over a dozen foster homes and diagnosed with a plethora of disorders including bipolar disorder and post-traumatic stress disorder. He was prescribed numerous psychotics, but they just made him feel doped up and completely lost. Instead, he was developing a relationship with a horse through equine-assisted therapy that helped Cortijo realize his potential and live a more full life. Psychotropic medication can help with thought disorders such as schizophrenia, mood disorders such as depression, behavior disorders, and attention disorders, but the medication does have side effects including reductions in the ability to experience emotions, problem sleeping, and appetite loss. Oftentimes, psychotropic medication needs to be accompanied by other forms of treatment, but in the case of foster children, it is not. 1.8% of children living in-home or informally with kin receive medication in absence of specialty behavioral services, while over 9% of children living out of home were using psychotropic medications without other mental health service use. Only with the appropriate use of psychotropic medication will mental health care for foster children be complete. High percentages of foster children deal with mental illness, yet the foster care system is devoid of effective mental health care, with impermanent living situations, inconsistent health records, disorganized treatment, and inappropriate administration of psychotropic medication, all contributing. In The Invisible Man, Ralph Ellison also wrote that responsibility rests upon recognition, and recognition is a form of agreement. The United States has the responsibility to recognize the plight of foster children with mental illnesses and honor that recognition with action. Without improvements to mental health care for foster children, this population will continue to be neglected, invisible, and unable to receive the quality mental health services they deserve.